It is Thursday, November 12th, 2020. We'll call the meeting to order. Please stand for the pledge. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay.
Thank you.
You're getting better. We will dispense with the minute. Do you have any minister reports? No, okay. We'll dispense with our liaison reports and the commission comments, bids and contracts. Any unfinished business?
No.
Okay, new business, CARE Act's funding.
Julie? Good morning, everybody.
Morning.
So, if you will look at your packet at the agenda, we're really just gonna kind of walk through what we talked about on Tuesday. But then also, if you'll look in your packet at the allocation proposal, which, so this is the document that we've been providing. But essentially what we did is we just allocated that $5 million into the various buckets that we had talked about, so that kind of at the end, if you see down below where it says remaining allocations available, and we would just call it phase 4. I think that would be easy for the community to understand. That, so for schools, we basically just included the $1 million, knowing that if you look above that $1,059,000, that was the original allocation that was accepted. You know, some of the schools did not accept it. So we essentially raised, if you look at the top section where it says 11, 12, 20, phase 4 reallocation proposal. So we allocated $1,059,000 to the schools, so that you know, that bottom line number is $1 million. We did the same thing for cities, and for the medical health care, we have not allocated anything additionally for nonprofits and small business, knowing that there is money available in the contingency. You know, if we get allocation or we get proposals that you all want to fund, we will still bring those forward. So there just wasn't any pressing, you know, kind of the need that we've seen has really been with the schools, with the cities, and with obviously the internal costs that we talked about for the for public health and public safety, but then also thank you. I was like, my mind just went blank. Yeah, for healthcare. So, so essentially, if you look at that document, you look at the very bottom line on page 2, over in the far right corner, you see $4,959,477. That is the remaining allocation as of today before any further approvals. So just kind of want to stop there, let you all digest that, ask questions.
Okay, so municipalities, what do we have total for them that we're looking at allocating?
So it'd be a total of $1 million.
I think, well, I need to get to, I've been flipping around your documents here. I think it's all on there somewhere. I'm just trying to figure out.
Yeah, if you go to page 2 and like on the bottom, you'll see remaining allocations available proposal.
So total for all the funding they've received would be 1.9 million. It'd be that initial 1 million and then
Okay,
900.
so up there, 18.
Yeah, thank you, Teresa.
No problem.
Okay, so they've got about $1 million left at the bottom, and then what do we have for internal, I guess is what I'm trying to find at this point. We've got $1 million left for internal, or?
Yeah, $1 million left for internal, and then 959 for just contingency.
Okay. Do we have any idea what kind of requests we've got in for internal? Because I don't know if we've put in for all our requests, say the salaries and stuff for health department, if that's included in some of these projected expenses or not.
We have not, and we've allocated the money so that we can put public health and safety towards that, but we've not shown any reductions for that purpose. So
Okay, I
essentially,
guess my point is just making sure that we have enough allocated to make ourselves whole after this, because we're spending a lot on this, and especially at the health department, we're spending a lot in the jail as well, you know, trying to keep people in there and safe, so.
And these are just suggestions. If you wanted to allocate it differently, we're happy to do that as well.
yeah, I mean, one of the things we could look at is if you all, you know, we could, you know, work with Kristen and Debbie. You know, if you have estimates of what you think that public health and public safety internal costs are gonna be, we could set that money aside and then allocate whatever the difference is to the cities and the schools. So essentially you'd have almost $2 million
Yeah.
available for internal cost recovery.
Yeah, the bullet point number 4 has county public health and public safety payroll at 1 million, and then our contingency is approximately 1 million. So we've got like 2 million, Jeff, that we can utilize, but 1 million is already set aside for EMS and so,
We do have all the trackers already approved in the internal application, so that is in that allocation already.
There are some internal recommendations today as well, so we can go over those too.
Okay, I just wanted to make sure that we have enough in there for our own stuff before we start divvying this all up. And I guess I've had other people I've talked to that have asked, you know, they've got plenty that is eligible for this CARES money, but they don't want to come in and ask us, and I'm going to exaggerate here, ask all if it's not going to be approved. But at the same time, if we know the need is out there, then we can be able to address that.
what category are they in, Jeff? Are you talking schools? Are you talking not-for-profits? Are you talking businesses?
It can be anybody, but in particular, talking with one of the healthcare fields that, you know, they've got more that they can request if we have some eligible, but they didn't want to throw in so many requests that they're just going to be denied right off the bat. So it's one of the things like, why do they need to go through all the work and make more work for us if they're just going to be denied? But at the same time, will it show the need for it if there is money that's turned back and we are eligible for some of it?
Phase 4 has 1 million for healthcare providers. And so I would say we don't have 30 million, but if we have 1 million set aside for the healthcare providers, yeah, they need to apply.
Okay, but let's say we do 1 million. Like I said, I was exaggerating. I had no clue what their number is, but we were just having a good general conversation about it and kicking it around, and you know, they're asking, do we apply for it? Do we put it in there? Do we waste time even asking for it if it's going to be denied? And I didn't want to make more work for us, or you know, just have them submit it so we deny it. So
I think phase 4 has 1 million for schools, another 1 million for healthcare, 1 million for cities, and then it has our 1 million for the county public health and public safety payroll, and then that still leaves us approximately another $1 million just in contingency. So, you know, if we approve this phase 4, then there's $1 million that's set aside for healthcare. So yeah, they need to apply. I don't want to talk for
okay,
BKD, but
if they have 3 million that they're really needing, why not apply for 3 million? And then it shows the need. And that's what I'm asking, do they do that, or is it just going to be wasting everybody's time?
So I think the need comes in really if the county can show, like I think the first issue is how much public health and public safety do you all feel like you need to be reimbursed? You know, is that $2 million, $5 million, you know, $1 million, you know, because to the extent that you can apply for those costs, let's say you come up and you say, well, we think we're gonna have $3 million and we've only set aside 2. So at that point, you can make the decision, do you want to go ahead and allocate the funds to the other, let's just say, healthcare providers, knowing that you can but show your need for an additional $1 million in public health and public safety. That is something you can do. It would be difficult for us to put forward additional costs incurred from subrecipients. So that's kind of why I'm saying anything that you all as the county can show over and above, it doesn't mean you can't fund it, but to the extent you can show that need, because those are costs we can put forward in the event there is additional funding.
Okay, so if even, I'll use the city as an example too, they submitted their application and it was way above and beyond. It would have made it all up if we wanted to put it all to them. So is it better for people to go ahead and submit these requests and it really shows the need for the money, that we do have the need? Or is it a waste of time at this point and just wait to see if we get more money?
Yeah, I mean, I think for them, for the subrecipients, it's more about, you know, what do they really need? Because we've already got, you know, $1.3 million, I think, when Teresa starts walking through the funding recommendations out there for you all to decide if you want to fund now or not. So it might be worth, let's see out of the groupings of what we currently have that we've already approved and what is it that you want to move forward and approve. Then that's going to tell you kind of what you have left. And then I think it would be a more reasonable request. I mean, for me, it would be, if somebody's got, you know, more than $50,000, I don't think that that's gonna, the cost benefit's probably not there. They need to put through what they really need, but if they put through $1 million, yeah, that's not, we're not gonna fund it, and we're not gonna be able to show the state that need. This
Okay.
the need through the internal county cost is what we're seeing.
Okay, I think that answers my question. I just,
Okay.
I don't want them submitting all the requests. I know, they're just wanting us to know that, hey, they've got a lot of expenses out there, and if they get the money from us, they get 100% funding on it, but if they go through other places too, they only get 75% or whatever percent it is. So that was the question, so it wasn't anything crazy. I was kind of trying to make as little work for everybody as we can.
Sure.
And Julie, my question to you is on those, the EMS, the sheriff, the health department. I know the requirements have kind of changed as far as payroll goes, and not having to show timesheets and all the documentation that goes with that. Is it still a percentage of what we feel like our departments have used for CARES or for this virus? Is there any specifications?
All you have to do, and I'll send you like some sample language that we've used with other clients. You just have to, and I guess that would be as the county executive, that would be as the presiding commissioner, I guess that would be you, Mr. Bushman.
Yeah.
Yeah. So you just have to provide a letter stating that we the county feel that these categories of employees, which would be things like EMS, firefighters, sheriff's department, anything like that, would be classified as working with the public related to COVID. So it's a fairly simple letter. I mean, it's just a good faith showing, right? So you don't have to classify person by person. It's really just taking broad categories of those types of employees. And then based on that, we'll say, okay, you're Sheriff's Department payroll cost, or let's just say, $1 million, then, all we have to do, we actually don't even have to provide timesheets. All you have to do is provide, an employee roster and payroll registers. So,
We've been keeping track of our COVID hours since March, so I can provide that spreadsheet easily. And we even have like the on-call hours that haven't been paid that, I would like to have people paid for. The overtime is not on there, that was separate, but anybody who's spent any time on COVID, we've been keeping track.
Good,
I just
Good.
think that would be a better.
yeah,
Figure
good,
that amount out first. But
Yeah.
That's up to you guys.
And I've been sending it to Kristen, but I can send it to you.
I just thinking about a dollar amount, what kind of
Oh,
dollar?
I can look at it right
yeah.
Okay, well, thank you, Julie.
so, if you want to kind of think through what we've talked about, and then Teresa can walk through the funding recommendations, and then we'll see, based on those decisions, kind of what we think we have left as we go forward.
Okay, sounds good.
I will start going through the funding recs. So our first one is gonna be that, the school district, again, this is the same one from Tuesday. Again, just kind of wanted to put this out on the application, or on the funding recommendation, just so you could see what their expenses were for that first semester, above and beyond what they already were approved for. The next section is new. This is some internal costs. The first one is, some from the health department. They want to do a mailer to all Cole County residents that would have a mask, some sanitizer, some educational materials, and those would get shipped out to everyone. And so that was for a total of $423,000 and some change. The next one is also from the health department. This is just some printouts for some educational material for any patient that's being tested for COVID. They would get this as they were being tested or when they were leaving. And then the last section in the internal is going to be kind of our miscellaneous. This is for the reporting process. Was anything that was in those emergency accounts that haven't been approved through the application process. So there was some cleaning supplies, a little bit of technology for telework. I think there was some webcams, some thermometers for the jail, a sign language interpreter. A lot was for some coveralls for the EMS, and then some miscellaneous masks and gloves and some other things. I'll let you guys discuss or ask me questions.
I'm pretty,
So the educational handouts, I thought that was gonna be quite a bit higher. I thought $1,000 was for 10,000 copies.
Let me look at the application and see how many it says on there. Yeah, it says that's for 10,000, and or no, actually, I think that's for 11,000.
We were talking about 20.
Yeah.
So we may need to revise
We can just
that.
adjust it
Yeah.
down, we can revise that up.
Well, I guess we could approve it today for the 11,000, and then it just had a price on there for every 1,000 more, we can just submit another one, so.
Yeah, it says additional thousands are 8720.
Well, I think just based on the numbers of how many tests they do per day, that they could hand them out, that 20,000 is not gonna go a long ways, because what are we figuring between $300 and $400, or 300 and 400 tests per day between the two facilities, or three facilities, and
just, yeah,
Yeah, it seemed like it was
Yeah. yeah.
so that'd get us in about 2 weeks. So we just wanna make sure we get enough and get the printing done when we can.
Yeah, I thought we were gonna do 20,000. I think we still probably ought to do just 20,000.
Well, the first quote they gave us was for 11,000, so we just said go ahead and print it. We know we'll probably have to get more, so, and it was like $87 per one more thousand. So if you want to approve 20,000, that'd be great, but like I said, the first quote they gave us was for 11,000 copies, so we just said yes to try to get them to order
Yeah.
the paper because the paper won't be in, but we probably will end up doing 20,000 copies.
Okay.
If you want to go ahead and approve that, that way we don't have to come back and ask.
Yeah, I
Did you
would,
guys hear all that?
Yeah, you want to approve for 20,000?
Yes.
So,
yes, please.
Let me do that math.
I think we might as well, we'll be right back next Tuesday.
Yeah.
Maybe.
I mean, we're gonna be here anyways. Just saves you from one other application, I guess.
Yeah,
Are we still good with doing the mask and hand sanitizer box? The $423,000.
Yeah, I still think that's, that goes out to every household in Cole County, so, and
And then mailing would be easier than trying to just.
mailing's gonna be easier, it's more expensive, but it's, hopefully you're insured they're gonna get them. These are the same people that mailed out the ballots, but, I think that's the easiest way to do it, rather than us trying to get 33,000 boxes out.
And then is the easiest way to get the address from the clerk's office or the collector's office?
I
I'm
didn't
not,
hear that question. What was that question?
Yeah.
What's the easiest way to get all of the addresses for each household, the collector's office or the clerk's office?
Talk to a politician. They know how to get the mailers out.
well, the census did supposedly every household,
They have
so,
banks that will tell you that. Mine was a voter bank that we got the stuff from for the,
Melissa.
sending stuff out,
Yeah.
campaign stuff, but,
Okay.
I think,
or the post office, if they have access to that, or how they suggest doing that.
I think we'll start with Melissa.
Yeah, I think
See if we can
Melissa-
get, some kind of on a CD or wherever they want it.
Probably, yeah, well, probably a zip file or something. We'll
Zip
have to email.
file.
I'm not hearing that either. I just hear, it sounds like Snoopy's teacher, or Charlie Brown's teacher, or whatever it is.
I said we were talking about talking to Melissa at GIS to see if she could put that on some kind of zip drive or something for them, however they need it,
Okay.
if that's okay. We'll-
Are you good with approving that, Jeff?
Yeah, I think it's a good thing. I do want to get the sheet that, I think we've just kind of been approving this week on the, what to do with your COVID test, or if you've got symptoms.
yeah, that's,
I've not bothered the health department at all with what I've had, and the sheet that I got from them was just greatly helpful. Because you can basically go on the bottom, and I took my crayon out and I wrote down the date that I first tested and stuff. And so, I know when I can get back out, and it's safe to be around other people. It's just a great piece of literature. I mean, that alone has been so helpful.
Do you think that's what we should put in the box or just education? Because we can put whatever we want.
I
in
think
there.
both.
Well, I think,
I-
yeah.
Yeah.
I would put that in there. I
Okay.
really liked it. I thought it was a great piece. Like I said, you go up, you follow the boxes down, you got a positive test. Yes, are you having symptoms? And you keep answering questions. It tells you exactly what to do.
Right.
And I know y'all are trying to tell me I gotta stay at home for 2 more months, but I don't believe you. I'm following this piece of paper.
Well, that's me telling, that
Good job.
you look better on there.
Well, I know y'all like this because you have a mute button there.
Oh, well.
So, I do, I really think this piece of literature is just a lot of information, and one other thing that I emailed Brian and Melissa this morning about was when you go onto our main Cole County website, there should be a great big red button or something that says, hit here for COVID information and get us directly to the health department or directly to, the CDC or whatever, because that's where I found a lot of information. I was just trying to figure it out myself and go through it and see what everybody else has to go through. And it's not too bad, but it could be easier.
Good idea.
So for 20,000, it was 1798 or 1799, rounded up.
Okay, do we just need to revise the application, or you have it there, you're good to go, we can approve it at that number?
We can approve it at the higher number.
I think that's what we were planning on doing. So I'm fine with that too.
Yep.
Yep, me too. I move we approve D-0504 for $17.98,
$17.99,
$17.99.
correct.
Second.
All in favor? Aye.
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 Okay.
And we're good with the boxes.
Mm-hmm.
Do we have that finalized? Is that, I mean, we didn't have everything decided on what was going in it. Is that gonna change at all, or do we just?
I think it included the literature.
Yeah, and Christie will come up,
Okay.
Christie will come up with that. But yeah, I think the more information we can put in there, the better.
Okay, I forget what that one email said, like, we get them the information we want printed and put in there.
And they print
Or
it.
do we have to come up with
Don't they-
33,000 more of these handouts,
No.
which that'd be another $3,000
No, they
plus or
print.
minus.
They print it, yeah.
So, just make sure it's covered.
Yep.
Okay, I'm good with it, let's roll with it.
I move we approve D-05-03.
Second.
All in favor? Aye.
Aye. So this next one, what's this, sign language interpreter?
Yeah, so I think at one of the meetings, you have the sign language interpreter.
It was
For-
early, yes, it was early on
Yeah.
when we first started with the COVID. It's just been.
Over at the sheriff's, we did over at the sheriff's.
It's just been hanging out
So
there.
this is just reimbursements then?
Yeah.
Correct, all of these are reimbursements.
Okay,
Yeah,
all right, I'm good.
yep,
Yep.
That's good.
yep.
I move we approve D-10-06.
Second.
All in favor? Aye.
Okay, so moving down to the healthcare, again, these are all the same as Tuesday. I did talk to Crystal about the new 37-foot mobile testing center, and she did say that it can be used for vaccines. Like I said last week, that the refrigerator is smaller and they don't have a freezer, but they could put things in coolers. And I think we talked about dry ice before as well. It just depends on the vaccine, how cool it has to stay, what they would have to do with that, but it can be used for vaccine transmission or for vaccine distribution. And I didn't hear anything about that other mobile unit that you guys were talking about last week. I don't know if you guys got more information on that one, the one that was a bit cheaper.
Now, who would held the, go ahead.
It's like there was only one exam room in that other one. That one that was cheaper, but anyway, obviously it's quite a bit cheaper.
So are they actually going into the exam rooms, or it's just parked there and people come by and get their test outside and then they go inside to process stuff? So that's kind of what I was curious about. Do you actually need to be able to take people inside into an exam room? When I got mine, they stood me up against the truck so I couldn't get away from them and shoved it up into my brain.
Did they find it?
Made me cry. Well,
I'm
they
sorry.
tried both sides.
I'm sorry.
But will they be going inside, so is the exam room necessary? I don't know. I'm all for getting testing and keeping people,
Well, I would think it'd be more for vaccinations, and if they come out with vaccines for this, and in February or March, we're giving those out, and the weather's cold, it might be more efficient. You could, to bring them in, because you've got to roll up your sleeves and all that other stuff and get the vaccine and then exit. And I know the one is 2 shots, but then they've got another vaccine for people that have COVID that's supposed to lessen the severity. And so I don't know, we're going to have a lot of vaccines potentially.
Well, that's a good point. I don't disagree with that. I think that is a good valid point. So then who actually owns the unit? And so do we have any say over that, or after they're done testing, they may say, okay, we're done testing. We don't want to do vaccine distribution, or do we get to say, yep, now it's gonna be used for that, and we have some say in it?
I think Christie can use it for other, you know, in the fall when she's going to the schools and things like that. So we would own it.
Terry, is that what the application is, that the county would purchase this vehicle?
I mean, the application is just for the cost of the vehicle, it doesn't really say who would own it. I think we talked about it when we had the first one, and I thought you were leaning more towards they would own it, so that they would have the upkeep and cost and things like that. And it would kind of be a partnership, but we could definitely talk to Crystal and see what her thoughts are.
Typically, if they purchase it, they're going to, and they're maintaining it, it's gonna be their asset, but then they would have to, since it was purchased with CARES money and federal funds, they would have to let you all know and have to let the state disposed of, so, or put to some other use that was not, you know, health related.
But there could also be an MOU with them that allows us to use it.
Yeah, we could absolutely set it up that way.
That's good.
Well, I'm fine with them owning it, that way all the stuff that goes wrong with it, they can fix.
Yeah, I'm fine either way, really.
Are we good with approving that to them?
So that would be just the mobile testing site or unit, not the rest of the stuff under E019, but is that the same entity?
No, that is,
So E07 is different than.
EO7 is
19.
Community Health Center. Yeah, in 1977, that's Cap Region, or I'm sorry, that's St. Mary's.
So I guess what I'm looking at is if we're giving them 328, we've only dispersed $500,000 between the other two at this point.
Correct.
And I kind of based that on how many tests they were administering. So if we're going to do this for the mobile testing unit, then I would think it's fair to open up probably another $500,000 for the other healthcare testing and reimbursements.
Well,
We had 1.5 in there to start with, right? We still have almost $1 million left for them.
Right. With the new allocation, we would have a full $1 million. I
yeah,
think it's
on phase 4, in phase 4, Jeff,
70 to 70.
there's another $1 million.
I haven't played with the numbers to see how we want to split that up, but I mean, I'd be fine with getting some more of that out and, not waiting until the last minute. If we're going to give it out, there's no sense waiting until, Christmas Eve.
Yeah, 976 would be the allocation for medical and healthcare before we made the adjustments for the proposal today.
Would that be less this mobile trailer, or
Correct. Yeah, less this mobile trailer.
would it be 600,000 left?
Correct.
I'm fine. I'm concerned about reallocating and not giving ourselves some funding to reimburse us for salaries
Well-
as we go forward.
And one of the things, if you want to hold, as long as we're spending the money, that's really the end result, is, if, we want to come back on Tuesday with kind of what those public health and safety numbers look like, so that you all have a sense of how much that would be, then that might also help.
I would say that the testing unit might be a little more time sensitive though, if you want to get that ordered and to you guys.
Well, yeah, definitely.
I'm good with moving forward with the mobile unit.
I am too. Jeff?
Yeah, we can play
Okay.
around with the rest of the money for the other, healthcare providers and their testing and stuff too, try to keep things, it's never gonna be equal, but try to keep it fair, so.
Do
We
you,
wanna go ahead and move with that, like you said, it is time sensitive.
You will have to then come up with,
allocate, I'm sorry, go ahead.
I was just thinking about the MOU and what you expect and how we would handle this, you know. I would think that would go with the award letter so they would know whether they want to accept or not. Because I want them to cover the insurance and everything else on this.
I'm fine with them owning it. I'm just kind of trying to think ahead about Sam's point of, you know, later on, we're not necessarily worried about testing so much as we are getting the vaccines out. I think that'd be a great use of it too, and just to make sure that they're on board. They may not have people that are able to administer the vaccines. We may have to use the unit, but get nurses or other people that can administer them later on. So,
Sorry,
I
Judy.
think we've had a good partnership with them, so I think we'll be fine.
Okay. You want to make a motion, Chris, to approve that?
Yeah, I mean, I think Christie and Dr. Sullivan can work out an MOU that is agreeable, so, I don't think it has to be anything fancy, so. I move we approve E-07.
Second.
All in favor? Aye. Okay.
Did you want to talk about any of the other healthcare, or do you want to wait until next Tuesday?
I'd like to get my numbers and kind of use it as how we disperse that, because I know that one of them got a little more than the other. It's based on the amount of tests that they're doing,
Right.
and we don't have to do it that way again. That's just kind of the way I had gone about it before, but I mean, we've got these here. That was just about, well, it's more than what we had left in it at 900 and some.
Correct.
So if we're fine, wait until Tuesday,
Yeah,
I can come back to the office if y'all let me back in.
if you could give us our total then with this new $1 million from phase 4 with what we've got left here, then we would probably be more knowledgeable about, you know, what we can allocate. And then if some of the health, what you're talking about, if they would submit more applications, then we're,
Yeah, they've got a lot more expenses than what they've just sent us.
yeah.
That they could apply for.
Yeah, and again, these are expenses they incurred after Medicare and after insurance paid them. So I mean, it is money out of their pocket. So if you've got more, and if next week, if you can tell us with this $1 million from phase 4 plus what we have left over, what we have for healthcare, then maybe we can take some action on it.
Well, I think to her point a while ago that what we find out we need for internal,
Yeah,
I'd like to do that before I actually say who gets what in phase 4. I think that's gonna make the biggest difference right there.
but phase 4 is still gonna leave us about $2 million on contingency and our county reimbursement. So,
Yeah, you want to include the 456 that we just approved today in internal. That's going to be taken off, so you'd probably be around 1.5 million if you include that contingency of internal and contingency.
okay.
Yeah, and I mean, I think that's a good number of placeholder to have in there to 2 million, but we just breezed through the $500,000 there without even blinking an eye. So we can do this pretty easy, and if we're out here giving it all away for other stuff, we're not gonna have to take care of our own stuff or what we see as a priority. So I think the boxes and the education and literature I think those are just gonna be a huge thing, and I don't know, they really helped, I thought. Expensive.
Yep.
Well, I didn't have any other recommendations for today. We've got some other on the sheet that we're not recommending for today. So there's only one outstanding application that's not on this list that we got. I think it was on Tuesday that I didn't get updated for this list, but it'll be on the next next week's list. And I think it was just for a not-for-profit or a small business, I can't remember. So not a lot of applications coming in right now.
Okay.
I mean, I would suggest to the extent, obviously, it would just need to be a reasonable request, but if people are holding off, I mean, and there really is a need, I think it only makes sense for you all to have more information in front of you, kind of what people are facing so that you can make those decisions.
I'm looking at the allocation proposal again, and under nonprofits, we had, looks like 156,000 and some change that was reallocated because it either didn't get requested. So if somebody is nonprofit and they submit something, and I'm gonna use the example of Zoom meetings, trying to get set up for decent Zoom meetings, will we just take that from contingency at that point?
Correct.
So they can still apply, and we go from there.
Yes.
Okay, thank you.
Mhm.
Who was,
That's all.
who was 3870 on the healthcare? I don't know that I've seen that on there before.
3870. Oh, that's St. Mary's again. That's their second application.
Just another application.
Correct, that's
Okay.
the expenses from, I believe, I want to say September through mid-October.
Okay. All right, thank you.
No problem. That's all I had, Julie. Do you have anything else?
Nope, that's all I have, so anything else?
So on that mobile testing unit, right underneath of that is the mobile test site boards and stuff. Those aren't related to each other. That's not the staff that testing, is it?
That, for the E1910, that's Cap Region's mobile test area. They've got the tent, or I can't remember if they've got a tent or not.
So on the mobile testing unit, they're gonna be able to staff it though, and not gonna come back and say, well, it's just contingent upon them getting more CARES money, are they?
Right, I think when we talked before, they said that they would do the staffing, but I'd have to get back
Okay.
with Crystal to see how she
Okay.
would want to do that.
Y'all might have told us that, I forget, I was just curious, so. That's
Yeah.
all questions I think I had.
Okay,
Okay. Anything else?
Teresa, thanks, Julie.
thank you.
Thank you all.
Thank you.
Bye.
If you commissioners could hang on just a second.
No,
Yes. Hey, I do, it's new business, I guess, just getting some direction. EMS department is getting rid of 2 ambulance. Do you want us to put that on Purple Wave or some other kind of place to try to get those surplus?
Well, I think we just need to get rid of, I briefly talked with Matt about it, about maybe using them for parts, but he said they've already been cannibalized and got parts off of them, so they're really not worth keeping around, and we'd also have to have a place to keep them and, try to keep them out of the weather, but, I don't know, how much do you think we're gonna get on Purple Wave? You got any idea? Because they're not even drivable from what I understand. One doesn't even have a rear end in it.
One of them isn't. I think one of them is drivable, but David's here, he can address that.
One's got the transmission out of it, the rear end out of it, and got a leak in the diesel fuel injector, but other than that, it's great. And we've stole a few parts off of it. So it would
as long as
be,
you don't need to go anywhere, huh?
yeah, I mean, it looks pretty. It works just fine sitting there as a paperweight, but that's about it. Whoever buys it will have to haul it off. It's not going to bring much. The other one is operable, but we know that it needs a bunch of money spent on an oil leak and a bunch of money spent on the air conditioning. And it was our oldest unit and starting to distribute rust. So it's not, neither one of them are going to bring much money, no matter how you sell them.
They don't need air till spring, so.
Well, we actually used it up until Friday, I think. We had to quit
Yeah.
using it during the real hot time, but we were able to use it for a few days there when it was cooler.
What do you think we'd get if we sold it on Purple Wave?
I'll tell you what, if the one probably won't bring
the one I
$500,
wouldn't.
the other one, if it'll bring 1,000, I would be surprised. Neither one of them are going to bring anything.
It's just the process
So-
we have to go through.
it's how,
Can we I might know somebody that might be interested in it, and they're not necessarily wanting it for driving at all. They use them for, you know, storage and stuff too, so they probably take the box off of it and then park the rest of the stuff out or scrap it, so. If I talk to them, I may have them get a hold of you, David, and take a look at them and have them bring us an offer, and we can consider it, or do we need to put it out there as, bids, or?
Well,
How can we, I mean,
the-
legally, how can we get rid of it? If we get somebody that's come bring us their best offer and we go from there?
The last two we sold off an offer. I don't know, I know there's some thoughts about advertising and so on and so forth. I just don't believe either one of these are gonna bring in a great deal of money, but I'll defer to the people who do this stuff all the time.
I think we still need to.
No, the person that I'm talking about is not gonna give a great amount of money for
Ah,
it either.
I get it.
It's gonna be somewhat easy to get rid of it because they are local and they'll come pick it up and get it out of there. And, you know, maybe it's a deal for them and they scrap it out and make some money on it and then we get rid of it and it gets it out of our way. So it's just, if we do it Purple Wave, then we gotta wait
Yeah.
and we probably won't get anything for it anyway, so.
I think we still need to list it though, and then they can always bid on it on Purple Wave or GovDeals or whichever website we put it on. And then if we don't sell it on one of those sites, then we can talk about getting rid of it a different way.
And that's traditionally how we do all of our stuff, just because that's how we get it,
Mhm.
so that's how we feel we should get rid of it.
What are we paying Purple Wave to get rid of it?
Do you know,
Gov deals is 12%, but the buyer pays it, so nothing.
The buyer
So we're
pays it.
on Gov
Paying,
deals.
if we sell it for $1,000, it costs us $120 is what you're saying?
And it costs the buyer.
Cost the buyer,
cost the
yeah.
buyer?
Cost the buyer, okay, so if the buyer wants to include it in the price, he buys it for $1,000, he pays $11.20 is what it amounts to?
Yes.
Okay, and then private people can just buy it off there too?
Yeah, they just have to create an account.
Okay, it doesn't matter to me, I mean, that seems fair enough too, because then if they are interested, they can get on there and have the same opportunity as anybody, so. So is that what y'all think, Purple Wave?
Is that-
Purple Wave, that guy comes out and does it, usually is Gov deals.
Yeah.
Whichever.
Kathy won't let me buy it, I wanted to, because I thought it looked great up in a tree for deer stand.
Well, I was thinking I'd get Leonard to buy it and then I'll make it my campaign vehicle for 2022, you know, and let Leonard paint it.
Okay, well, I'll bring the surplus title to you guys probably next week.
You're losing us, Debbie.
Sorry, I know. So if you're good,
Okay.
that's fine, we'll do it one of the
Okay.
two ways.
Okay,
And that's all I have.
okay. But we need to do the advisory. We need to approve the advisory, and I think you've all seen it. Do you?
And the mayor is on too, she wants to turn on her camera.
Hi there, I'm here as well. Let me get this turned
Yeah.
on.
So we've got the Cole County and City of Jefferson COVID-19 Advisory, November 12, 2020, that we need to approve, and then we sign it, Carrie signs it, and I think everybody has probably seen the final.
You might want to read it for the press, and I don't ever.
Okay, call to action, we need your help. With,
Hang on.
huh? Oh. Well, I'll give him the copy.
I know.
Yeah, I've got the copy here, and then I've got the one that we need to sign.
I'll make a copy. Which one you gonna read?
See, this is what happens, we don't have me and Chris there to keep Sam in line.
Okay,
Go see him.
okay. Call to action, we need your help. With the number of COVID-19 cases on the rise, we need your help to slow the spread of the virus. Cole County and Jefferson City are advising every person in Cole County to, bullet point 1, stay at home if you are sick. Bullet point 2, physical distance from others outside your household. Bullet point 3, limit gatherings to a number that physical distancing can occur. Avoid gathering where physical distancing cannot be maintained. Bullet point 4, wear a mask if you cannot physically distance or avoid gatherings. Bullet point 5, 6, whatever. Encourage telecommunicating and physical distancing within office buildings. Final bullet point, offer low-cost shopping methods, including curbside and delivery, and increase distance between seating and restaurants. Together, we can slow the spread, but we need everyone to do their part. Protect yourself, your family, and others by following these guidelines. We are asking for your help. Please do your part. Mayor Turgeon says, please reconsider any plans that include gatherings. We ask these recommendations be followed because we care about the health of our community. We want our businesses to stay open, and we have worked closely with our local hospitals and physicians in offering this guidance. I said, now more than ever, we need to be careful. Socially distance, wash your hands, and if you are sick, stay home. Wear a medical grade mask if you can't socially distance, and if you don't feel comfortable at a meeting or gathering, leave. Use common sense and be safe. This is not a mandate and does not include enforcement by the city or county. It is an advisory. Please do not call the Cole County Health Department with concerns about enforcement of this advisory. So, and then it has, for more information, visit CDC website and the Missouri Department of Health and Senior Services website or Cole County Health Department website. So,
Yep, I think we're all good. So I move that we sign the advisory.
Second.
all in favor? Aye.
Aye.
Okay.
And I'll use your stamp so we can get that to the mayor today, if that's okay?
Yes, thank you.
Yeah.
Commissioner Bushman,
Yes.
Mayor Turgeon here, thank you for doing that and working together, the city and county and Cole County Health Department, to come up with this advisory, and really ask that people take that seriously. And as I've heard from people and asking what they should do for Thanksgiving and gatherings and even just their regular meetings and holiday parties, or you name it, been able to use the items that are listed in the advisory to tell them not to have those or have them in other methods. And so people have been very thankful for that guidance. So glad we're going to getting that out today. And also, while I'm here, I'll mention too that we are having some issues also even with our transit and some employees that are not able to be working. So we're going to be seeing some service issues with that as well. So that will be coming out today as well, what the plan is moving forward. But we're seeing that as people are either getting this or having to isolate, that it is going to affect city services and potentially, may affect some of your services as well. But we're trying our best to do what we can and appreciate the county's support on this too. So thank you.
Thank you.
I also want to
Thank you,
remind
Mayor.
everyone that the governor's doing a press conference at 9. It sounds like there's some changes into schools of who's going to be considered a close contact in the school setting. That's at 9. We've already been getting some advance notice of it. I've been sending it to the schools as I got it so they would know what's coming. And then they're also having a representative from Pfizer to talk about the vaccines. So that's at 9. And then we have a press meeting at 10 that we're doing virtually, where we're going to roll out a new contact tracing strategy for Cole County. Lots of changes today.
Yes. Okay.
All right.
Anything else?
We got an email from Matt about increased calls and stuff, and I know we can't bring it up in the meeting necessarily, but I think we need to get moving on that. I'm trying to find the email now. I was just thinking about that. I just think we need to give him permission to kind of try to work on getting a plan together. Talked to him briefly yesterday and looking at trying to figure out if we can do another 12-hour shift or 24-hour shift. The problem with 24-hour shift is we have to have a place for them to stay. I just thought we need to give him some direction and get moving on this stuff too, because their call volume's increased, and I think one of his emails had mentioned that some of our other neighboring ambulance systems are not able to do as many transfers and stuff with this this COVID. So I don't know, we don't have to take any action today, but I think we need to decide if we want to give them direction.
I agree. You know, when he had said Tuesday morning that we had gone through 30, we had to dress out in PPE for 30 calls already that week. And then they had the piece on Columbia hospitals, and I think Boone County was saying they're turning some away. So when we have to transfer to St. Louis, and I don't know what's going to happen if their hospitals fill up, we're going to have ambulances out of service for a much longer time, and we've got to take care of our citizens in Cole County. So I agree, whatever, I mean, these are not normal times.
Food for thought, if I can chime in,
Yes.
just something to be thinking about. Obviously, we don't have to bed 12-hour people, we don't have to provide facilities for them because they're stationed on a street corner. But I will tell you, it takes more people to staff a 12-hour truck because you've got 8 instead of 6 you have to hire. Plus that, it's harder. I can't hire people from farther away to staff 12-hour trucks. That's the only point I'll make. So I can hire somebody out of St. Louis that'll staff a 48-hour truck, that'll come in and work for 48 hours. But they won't drive in for 12. I mean, just food for thought. Whatever you guys decide.
I would say do what you've got to do to get paramedics to man additional trucks, because I don't foresee our numbers going down anytime soon. And
We might be thinking about where we could stick a couple more people at
Well-
a time, because I can't put them in headquarters because we're pretty well, I won't say can't. I'll
No.
just say that we need to be thinking about it. So we'll try and come up with some recommendations, but I know we would ask that all of you gentlemen put your thinking caps on as well, because this is uncharted territory for everybody. And we're already seeing transfers to St. Louis and Kansas City because Columbia can't take them.
Yeah. And ours are full, yeah. Sorry.
So, we talked about the old health building, and that's really a no-go because we have to knock a hole in it and put some bays in there. You have to be able to secure the narcotics. Then we talked about over at the existing building, Emergency Services building, and we've got a couple offices in there, but I think that, I think Sierra might have moved some people around or something over there and took over one of those offices. And if we have to empty that office for right now to deal with this, then we're just gonna have to do it. 'Cause that front office, we can put people in there. If we need to put cubicles up and give them a little privacy, let's do it. We gotta do what we gotta do here.
So, yeah, I think the court services is occupying one of those offices and Tracy's in the other one out of the two I believe you're talking about. Which, what I
So
say.
is court services actually over there right now doing work every day, or what do they got going in there?
What I was told was that we needed to be out of that, because we still had a bedroom in that one office, that back office, until we got a door last Tuesday. And Sierra texted me and said we needed to get the bed out of that room that day because court services were moving in there. Because I don't know what they're doing, so they're scanning documents or
Okay,
something.
I don't remember telling court services they had that office. But we've
I-
been over there for a while, they've
Yeah.
been scanning stuff, so.
Not
we just
my-
need to see what we can do temporarily, if nothing else.
Okay.
I think I brought this up and Matt said it wouldn't work, but you've got a lot of motels close by too. If you did, what is
And
it?
then we gotta leave the ambulance set out in the
Well,
parking
Yeah.
lot of a
you can't secure the
hotel.
narcotics.
Yeah, that's
Right.
true, yeah. Okay,
Cause I thought about that too, Sam. I think you mentioned that before, and I thought, well, that's a good idea too, but then it got shot down pretty quick, so all these rules and stuff. So, well, I'll keep thinking about it. I don't have the perfect solution for it.
Thank you.
no, you,
What about that, hey David, what about that back bay where they used to sleep and stuff, where our EMS used to be, back there?
One of them is full of medical records. We could move them, but the medical records still have to be secured someplace under federal law. That's why we added the cameras and stuff back there, so we can watch who goes in and goes out for the medical records. The other one's used for a storage room for uniforms and bunker gear and all that. Both of those are being utilized, but it doesn't mean that, we can't reinvent the wheel. We just have to find some place to put the other
Might be a
stuff.
short-term solution
Yeah.
if we needed to move that stuff out. 'cause
Well,
we
we're-
did-
we're
people
willing
did
to-
Sleep back there.
Yeah, we're willing to look at anything.
Yeah,
So I don't know, I mean, but we could secure the ambulance there inside the building then. We had to move some stuff out. Just a thought.
Yep. Thank you.
okay. Anything else?
Hey, hold on.
Okay,
Do you have press conference today, Christie?
she left the room, yes, at 10 a.m.
Oh,
At 10, I guess.
well,
And it's a webinar, so,
no, I've got a lot of time to sit around and do stuff. I got all kinds of jokes for y'all if y'all need them, so. You know why ants don't get the COVID? Because they have little antibodies. Oh, no, they're getting bad. I got my Christmas tree up as a good news too, so. I'm ready for St. Patrick's Day too. I gotta get out of here, guys.
yeah. Chris, you want to move to recess, you want me to?
Go to the woods, Jeff.
I'm getting packed up. I'm packing up my whole house right now. I have nothing else to do, so. And then I figured out how to save a lot of money for Christmas too. I'm sending out cards to all my nieces and nephews telling Santa didn't make it through this pandemic. We got this thing. Oh man, idle hands, guys, idle hands.
I move we recess till 4:30.
Jeff, there is a press conference at 10. I'm not sure if you're gonna be invited after all this comments. There is one at 10 o'clock. And it's by WebEx.
Canceled up.
That might interfere with the soap operas.
It'll be on WebEx. And I think
Okay.
they might have sent out an email with the information. Yeah, thank you.
Yeah. Perfect, thank you.
Okay. I move we recess till 4:30. Anybody want a
We
second?
stand recess till 4:30.
Second. All in favor? Aye.